Welcome to UNCAGED. Today we're speaking with Dr. Pamela Oliver. Pam is the Chief Medical Officer at Novant Health. She's also an EVP there, and she's a practicing doctor of obstetrics and gynecology. Novant Health is a leading healthcare provider. They have over 15 hospitals and over 300 physician practices offering advanced medical treatment in North Carolina. And they've really been kind of a great growth story as a health organization over the last several years. And so I'm excited to talk to you, Pam, about the work that you're doing there. But before we get there, tell us a little bit about you and your background.
Well, again, thanks for having me. I am a Eastern North Carolinian. I'm a country girl from North Carolina, from Rocky Mount, North Carolina.
Woo.
Born and bred. I've stayed in the States, so edged my way west from Rocky Mount. First generation college grad. Went to Chapel Hill, yay, Hills. We'll talk about that later, won't we? For undergraduate, and stayed for medical school and public health. I didn't really know that I wanted to be a physician until I was in late high school. I was really good at math, so I thought maybe I'd be an accountant. And my father experienced an illness. He had leukemia when I was in high school, and it exposed me to medicine in a way that I'd never seen it before. And that directed my steps towards pursuing a career in medicine. As I said, got my degree at UNC, and then I ended up in Winston-Salem, North Carolina, which is where my husband's from, to do my residency program in obstetrics and gynecology. So, women's health really spoke to me when I was in school. I really loved the idea of taking care of women and tackling some of those issues one-on-one. But I also did my master's of public health because I saw healthcare a little bit more nuanced than just individual care, thinking about populations or thinking about ways that I might be able to impact the health of women, even outside of one-on-one care. And so didn't know what I would do with that at the time, but now as I sit here as Chief Medical Officer, leading a large health system in the South with many hospitals and in charge of our safety, quality, and equity, it's all coming together.
Wow. Well, I mean, an amazing story. It's incredible. I imagine the whole practice of obstetrics and gynecology has evolved so much. My grandfather was a gynecologist, and I really kind of remember him as like a guy who would like have a glass of scotch and a cigarette. And I was just like, you're a gynecologist?
I don't fit that mold.
Like, yeah, like, aren't you supposed to be the healthy one? But I know it's evolved so much, and thank God there's more women involved in it now. But before we get into kind of like talking about the specifics of what's happening broadly in the healthcare space, tell me more about Novant Health and what you're doing there as a chief medical officer.
Yeah, so as I mentioned, I've kind of grown up in physician leadership at Novant Health. So starting at our practice level and then taking on increasing levels of responsibility. And we're blessed to have very strong physician leadership within our entire organization and a dyad partnership with our administrative leaders. And so I've kind of grown up through that. And for the last 5 years, I led our medical group, our employed physician base, our ambulatory clinics across the state, and very much responsible for that aspect. And this year transitioned over to this chief medical officer role, where now I think, especially as an OBGYN, where we live in all these spaces, we have practices, but we are in the operating room, we're delivering babies, staff in our hospitals. It's now activating that part of my clinical expertise. And so I have the pleasure of leading a team that looks at, I tell people, we work hard so you can sleep safely at night, whether it's you as a patient, you as the community, to make sure that the care we're delivering inside of our hospitals is top-notch care, right? That we are like just unequivocally focused on safety and quality and equity and experience when it comes to a patient experience. So a patient journey through our system. So when you need us, we hope that most people don't necessarily need us on a regular basis, but when you do need us, my job and my team's job is to make sure you can depend on getting the best care, and that we hold our teams responsible and accountable for a culture of safety and quality.
So, I mean, in a role like being a chief medical officer, you get exposed to all of the challenges that are coming in to the organization. You're the guru. They're going to ask you your perspective. What are you seeing right now that are some of the key topics that are bubbling up for the organization?
Yeah, several things. I mean, I was just talking this morning about the challenges on healthcare in general. Is cost is an issue for the
Yeah.
US healthcare system. And some of that is there's just so much to go back to. I don't love to say that the system's broken, but there's
Mm,
just so much opportunity within our system that other countries don't have. We do not have coverage for everyone. Therefore, the economics of that create maybe a little bit more of a cost burden on those who are insured, which then now, because our coverage tends to be linked to your employer, is a
mhm.
challenge for businesses and employers, right? So cost is definitely something that we battle. And as we try to do the right thing by our teams, the cost of delivering care does go up because the people that we value and depend on need more, whether it's with
Right.
inflation and everything else. So cost is definitely something that we continue to meet head on to figure out how can we make sure we eliminate unnecessary costs where we can to still make it reasonable and affordable for people to get care. I would also say there's a challenge currently when it comes to just the state of the health of our people within the US, chronic diseases and the issues that creates and being able to get ahead of how do we prevent some of this so we can prevent the strokes. We do a really good job with stroke care and heart care, but how do we get ahead of that to even be on the side of prevention so that we don't end up with a aging and sick population that then leads to higher and higher cost of care.
Yeah, it's a really interesting one. I mean, for us, we work heavily on a global stage. And so, constantly, obviously, when we talk to our European colleagues, they always wonder why we all don't have free healthcare. And that's always the discussion. And it does seem like there are challenges, there are small steps being taken, every day, I think, and so that I think is a positive step forward for broadly healthcare in America. And I would say, I don't know if this is true or not, but it seems to me that every generation seems a little healthier in kind of how they're going about their lives. Am I wrong about that? Or, yeah.
It seems that way. It does seem like this, as a teenage, we tackled teen pregnancy and risk-taking behavior in teenagers for years, and we've actually seen that go down, right? And fewer teens are smoking, and and that's all a positive. And at the same time, we have the highest obesity rates that we've ever had,
Mhm.
right?
Yeah.
And we have to pay attention to our foods and my grandparents may not have felt like they had this healthy lifestyle and that they didn't exercise or because they worked in fields and they did things
Right.
that kept them active for longer periods of time. They also lived a kind of organic life because they grew their own food, and they
Right.
raised their own animals, and our food sources now are just so different. So you're right. On the one hand, it feels like we should be all tracking towards this nirvana of healthcare where we should have the best outcomes. And so when
Yeah.
we're not, I think what we're seeing is there's this greater disparity between what you can afford, how healthy you can afford to be based on, how you grow up and what factors you value and your access to good food.
Yeah, no, that's a really good point. We do essentially kind of seem to be kind of taking one step forward and one step back. So there you go. Well, but somehow, hopefully, at least elements are improving. But let me change gears a bit here and talk about kind of that moment, I suppose, where you really knew this is what you wanted to do. We've been trying to understand really what motivates people to do what they do. And I mean, you are the chief medical officer of Novant Health. I mean, this is an amazing role. What keeps that passion for what you do going?
It was a great one. I mean, I mentioned, entering medicine as a career was, really influenced by experience in my father's healthcare
Yeah.
journey. And then, once I was practicing, administrative leadership is very different than day-to-day practice. I was a really good physician. I connected with my patients, had a thriving population of patients that, I loved and practiced. But, there was a point at which I think, there's a part of me that's always been driven either from leadership or just continual improvement, and as I got involved more and more in those aspects and took on more responsibilities, I was finally at a point where the question was raised, is this the time, do you want to take on this role as an executive leader, a physician on the executive team, to do this? And really had to debate. My children were younger, they were
Yeah.
teenagers, husband who's a dentist and working. And,
Yeah.
as you increase your leadership, sometimes we often have to decrease the amount of clinical care delivered, which is why I even got into medicine, to take care of patients. But what got me there was, and appreciating that it was time to make that step, was I really value physicians being at the table and the voice that I could bring to the table when it comes to major decisions for our health system and our communities that were really about patients and direct patient care. And what does it mean to take care of patients at the bedside? That has to be represented in rooms where major decisions are made. I'm a woman of color from a rural community, and there was perspective that I felt like I could bring to the table that would augment and help us make the best decisions when it comes to taking care of our patients, whether it was strategy, whether it was about quality or equity in every realm. And so that was the point where I said, if I can do that, that's what brings me value, because ultimately
Yeah.
it's about driving impact.
Yeah. Well, I think it's always interesting, that kind of that moment where you battle between being a clinician and then also really playing a key administrative role and trying to figure out how to balance that moment. It's tough, as a sports thing, it's like a player coach type of idea, right?
Well,
But
I think some physicians think, well, now all you have to do is meetings. I mean, the is not easier. I would tell you, it's not easier. There's a lot about being a physician today is challenging, and being a leader is not easier. And no, you can't win. So I'd say if everyone is a little unhappy, we're probably winning in that perspective, that sense. But yeah, you definitely, it's a
I
taking a
think that
step on
may be
the
the way
dark side.
I begin meetings now at the company. It's like, is everyone here just a little bit unhappy? Yeah. Okay, good.
That's how I run my family too. As long as everyone's a little bit unhappy, we're good.
Excellent. Well, Pam, I mean, as you look forward over into really 2024 and what you and the team are planning, what are the moves that you and the team are making?
Yeah, well, a few things. I mean, I have the pleasure as the chief medical officer. I not only lead the safety and quality, but I also lead health equity for our system. And for us, equity is everyone we take care of having the best chance at health that they could possibly have, having access, regardless of whatever dimensions of diversity you have. And so for me, it is we are at this intersection of how we provide the safest care for every member of our population. So we're tackling head on some of the disparities that we have in outcomes, whether it's heart failure, patients who may have heart failure and their outcomes, either from a mortality perspective, which patients may die, what treatments they get, do they have access to care before and after coming into our hospitals. That's the pinnacle of success, where we don't just say we check the box and it looks good on paper, but we know that we're doing it consistently for all of our patients. And so we're digging in deeply when it comes to health equity and to safety and quality. And that gets me excited, because that's what our patients and our populations deserve. And if you're watching healthcare unfold, we have a crisis right now when it comes to rural health in most of the country. And like we say, where you live should not dictate how healthy you can be and what your access is. And so we're all in, whether it's urban communities or rural communities, and helping to figure out how we make sure that we support the facilities that are there, even if they're not our own facilities, to make sure patients and communities can get care or have access to our teams who provide high quality care. And the thing that we know will make us successful is we're going really deep on culture within our teams, because every member of our team has to own that safety, quality, equity are important, and what their role is in that, and do all the steps that it takes for us to be successful with that, not having it dictated from me to people and translate it, but that they understand it and that they are all in on it.
Yeah, make it really a core pillar for the culture of the organization, just a true commitment. And I think that rural urban discussion on healthcare is a fascinating one. It's not something that we think a lot about. I think we definitely talk about equity and inclusion and kind of the socioeconomic challenges on the US health system and how to make it much more fair and literally helping all of our society. You know, my parents live in a rural community, and as they are now aging, it's a big concern. I mean,
Right.
it's shocking points
Yeah.
what they come across on the healthcare side, and it's really kind of like a dilemma for the family. You know, what do you do? Because that, you know, as you know, rural people like that lifestyle, so they don't want to go move to the city.
We're not going to change that. 80% of the counties in North Carolina are considered rural, right? And it's
Yeah.
I grew up. I mean, where I grew up is a considered a rural community, and yet I would want my mother, is still lives in that community, my aunts and uncles, and I want to know that if they need care, they can go to the local hospital, and that the relationships exist that they can get to where they need to be if they cannot like take care of all their needs there. And so there is a lot, like we will never control all of those relationships, but the more we solve what success could look like, the more we figure that out, we could be a model then for what that could look like for others.
What are you seeing in terms of the employment of technology in terms of helping in some of these things?
Yeah, that's really interesting, a great one. So if you think about even one of the biggest issues in the US from a disability perspective is stroke, right? As we talk about when we
Right.
have populations that are not healthy, stroke is obviously a major thing. And also time is not on your side to get care and to get the right intervention when it comes to having a stroke. So when one of the things that we've had the most success with is we have a technology, it is AI driven, that does an overread of a head scan when a patient comes in with a suspected stroke that then can pick up certain types of strokes so that it doesn't is not reading it for the radiologist. It pings our radiologist to let them know there is a concern here, there is an issue here, and it sends it to the top of their list to then read.
Right.
Therefore, the patient who comes in, we can then trim minutes off of the time it takes us to both diagnose the stroke, get our team set up, and get them the materials, the clotting factors, that the clotting meds that can help to break up a clot if it truly is a stroke,
Wow.
right? And so we, the national standard was an hour, like from, patient comes in, and an hour for us to treat. We've gotten that down to 20 minutes, right? Because of our ability to set up the teams, to have, deploy the technology. And so those are the ways that technology will be an enabler. It's not taking over the radiologist's job. It's just saying this needs to go higher on your queue than the patient who, has some other issue, who's sitting in the emergency room that isn't urgent, but time matters more when it comes to
Yeah.
this. So that's an area where I think is yet, I go to a lot of conferences, and it's still yet to be seen how many of the technologies play out, but that's one example where we have had success and are glad that that's improving the outcomes for our patients.
That's exciting. I haven't heard much about that. So that's a amazing, amazing improvement. I mean, wow, 20 minutes from an hour, that is a life saved, really. I
It's
mean,
the difference
that,
between
yeah.
walking out versus having permanent disability.
Yeah, it's a really, really great example. Well, Pam, it's been amazing talking with you. If someone wanted to learn more about what you and Novant are working on, where's the best place to reach you?
Well, you can follow me on LinkedIn and follow Novant Health on LinkedIn, and NovantHealth.org is our, website with much of our information about, all that we do, and happy to support and connect with peers. We're all in this together, trying to tackle healthcare and equity and everything there is related to that. So I'm just
Yeah.
appreciate you taking the time with me today, and
Yeah.
look forward to get to know you better too.
Well, Pam, it's amazing to talk with you. I mean, talking with a Tar Heel, you're not so bad from this Blue Devil on the other side of the video channel. But I'm really, really impressed with the work that you and the Novant team are taking on. We are living through, I would say, an epic moment in the healthcare space. So much is changing, so much possibility. And it's great to see that happening in North Carolina and South Carolina and pushing all of this forward. We've been speaking with Dr. Pamela Oliver today. She's the Chief Medical Officer at Novant Health. And, I think that we've talked about a lot of key topics today. The healthcare field and wellness in general is shifting dramatically in the US. We're seeing a lot of work being done to try to make sure that we make it more equitable, make sure that we're tackling problems faster, use technology in a smart way, make sure that we change the culture of healthcare so that it's more inclusive, that we think about urban and rural challenges and we address those and make sure that we bring it home. And that's clearly an important one. The US is a big, big place, and places like North Carolina, whilst they have lovely cities like Charlotte and Raleigh, there's a lot of rural communities there that need great healthcare. So Pam, amazing to chat with you today on Uncaged, and we look forward to having you back.
Thank you. Have a great one.